Welcome back. In today's session, we will discuss a homeopathic remedy called Coca. The common name of Coca is erythroxylon coca. It is proved by Clothar Muller and belongs to the family Linnae. You can see erythroxylon coca. Coca is used by the natives of South America. Just like we use coffee, tea, and tobacco in India, in South America they use coca. It is like tea and coffee in arresting the tissue changes. It enables those who undertake coca to undergo an unusual fatigue. So you see, the users of coca will have an unusual fatigue. It contains an alkaloid called cocaine. Guiding symptoms. Coca is a mountaineer's remedy. Coca is useful in complaints which are incidental to mountain climbing. What are the complaints which are quite incidental in mountain climbing is the anxiety, palpitations, insomnia, shortness of the breath. So you can see here they have symptoms because of the mountain climbing. They have anxiety, palpitations, they have dyspnea, they have shortness of breath, and insomnia, sleeplessness. It is suited to persons who are wearing out under the physical and mental strain. So, this girl or the woman you can see in the picture here, she's worn out. She's completely worn out because of the physical and mental strain. It is given to those people who are having a very busy life. Imagine those metropolitan cities and all those busy areas wherein people will be exposed to a lot of physical and mental strain, and they suffer from the exhausted nerves and brain. The other remedies which are indicating to this exhaustion of the nerves and brain because of the physical and mental labor is the fluoric acid, kali phos, and nux vomica. Shortness of the breath in old people and who use tobacco and whiskey in excess. So, guys, we saw the shortness of the breath. The shortness of the breath was seen in those who undertake tobacco and whiskey in excess. So, let's just draw a bottle here, whiskey in excess. And we also see the shortness of breath in the mountain climbers. The shortness of the breath or the want of breath in those who are engaged in athletic sports. You can see this athletic sports person, there is shortness of breath. They long for alcoholic liqueurs. They have desire. They desire the alcoholic liqueurs. They like the tobacco and all sorts of stimulants to which they are accustomed. Violent palpitations. The violent palpitations occur from the incarcerated flatus. So, the flatus, which is neither able to come from in the form of eructations nor they're able to pass the flatus, it is just incarcerated from overexertion. So, the violent palpitations are occurring because of the incarcerated flatus. You can take it like this. They have this incarcerated flatus and the violent palpitations. The palpitations are occurring due to the incarcerated flatus. The other remedies which have these indications are argentum nitricum and nux vomica. Violent palpitations also from overexertion. Let's consider this guy has overexerted himself. From heart strain, you can see from heart strain. So, in the conditions wherein the person has heart strain, the heart is performing a lot of function, it is overstraining itself, there is some problem for which the heart is overstraining itself. It is working more than the normal frequency. So we see when the palpitations occur from the heart strain, from overexertion, incarcerated flatus, we have to think of Coca. Violent palpitations from heart strain is also seen in arnica, borax, and causticum. They are sleepy but can find no rest anywhere. So guys, we saw insomnia. So people have insomnia. They are sleepy but they cannot find rest anywhere. You can see the picture and remember it, okay? Just this picture, you have to write Coca. We have palpitations of the heart. Palpitations because of the incarcerated flatus, because of the heart strain, and we also saw, what are the other things we saw? From the overexertion. And then we saw the sleeplessness. They are sleepy. We also have two things here. One, there is sleeplessness, insomnia, and she is sleepy but she is not able to find the rest anywhere. Mental symptoms. Coca patients are extremely bashful and timid. They are very shy and timid people. They are always ill at ease in society. Always they have some problem, issues, pessimism. They are always ill at ease in the society. Melancholic from nervous exhaustion. Like in we saw, there is exhaustion of the brain and nerve power. So they also have this melancholy, sadness, crying, weeping because of this nervous exhaustion. They are sad, irritable, and delights in solitude and obscurity. So these people want to be alone. They dislike company. They desire. They find peace, and they are delighted, happy to be alone. They lose all sense of right and wrong. So the Coca patients, you see, they lose the sense of what's right, what's wrong. So they lose the sense of right and wrong. So what are the mental symptoms, guys? You can see the picture here. Very timid, very bashful, shy, and then they lose the sense of what is right or wrong. There is also ill. They are always ill whenever there is ease in the society, yet they are very ill natured people. Melancholy is occurring because of the nervous exhaustion. The patient wants to be alone and they lose the sense of right or wrong. What are the ailments from? Can you guess from the picture, guys? Ailments from? This is ballooning, or we also had mountain climbing. And this other remedies which have ailments from high altitudes or mountain climbing is arsenic. So we also have the ailments from bad effects of stimulants, alcohol, and tobacco. You can see the stimulants, alcohol, and tobacco. So guys, always remember, if they ask the ailments, mention the ailments from in Coca. If they ask the ailments, we have ballooning, then we have mountain climbing, stimulants like beer, tobacco, etc. General modalities, they are aggravated when the patient is ascending in the high altitudes. You see, the patient is ascending up in the high altitudes, then the complaints are aggravated. They feel amelioration or they feel better by taking wine, or when they are riding in an open air. When the patient rides in an open air, he feels better. Moving further to few particulars of Coca. We have the head symptoms where the patient has vertigo and fainting. The headache is associated with vertigo. So they have vertigo, okay? They have vertigo and the patient faints. He loses consciousness. And we next have vertigo and loss of consciousness, fainting. The headache is also associated with vertigo. Headache plus vertigo. They have flashes of light before the eyes. Okay, guys. So they have vertigo. Okay, vertigo. Headache plus vertigo. Flashes of light before the eyes. They have this flashes of light before the eyes. Fainting fit is from climbing mountains. We saw when they ascend the high altitude, they faint. Okay. Shocks coming from the occiput with vertigo. They also have this shocks coming from the occiput. The shocks are coming from the occiput with vertigo. It is associated with vertigo. Headache is seen in high altitudes. There are noises in the ears and diplopia, double vision. Okay, they see double. Diplopia, double vision. And they have noises in the ear. Clear, guys? So what are the symptoms we saw? Headache is associated with vertigo. They have fainting because of climbing the high mountains, and the symptoms, the shocks will begin in the occiput. They are associated with vertigo. Headache of high altitudes, noises in the ears, diplopia is associated. Nose, epistaxis passing from right to left nostril. So the epistaxis will begin on the right and moves to the left. Okay, right to left. Sense of smell is greatly diminished. So they have the sense of smell greatly diminished, nearing to anosmia. Throat symptoms, the uvula feels swollen, the swallowing is difficult. Guys, you can see the uvula completely swollen in the ear in the Coca patient. Hence, the swallowing will obviously be very difficult to the patient. Dryness in the throat early in the morning. Respiratory organs, they have a weak voice, rapid breathing. They have rapid breathing, painful shortness of the breath at night. Because of the shortness of the breath, they have this rapid breathing. They take rapid breath. It is because they have this shortness of the breath. Shortness of the breath is also seen in athletes who take alcohol or tobacco in excess, and also in the mountain climbers. Hemoptysis. Hemoptysis is seen on coughing along with the pain in the occiput. So you see, on coughing there is blood. We have hemoptysis. Along with hemoptysis, there is pain in the back of the head. In the occiput, there is pain. Cough from cold air or fast walking. They have cough when there is when they go in the open air, and from the fast walking they get cough. Expectoration is of small lumps like a boiled starch. The expectoration of the patient will be like that of a boiled starch immediately after rising in the morning. So guys, you just think this is a jar, a boiled starch, a leaf or something. You are boiling it. So the boiled starch, it will be small lumps. When the boiled starch, how does it appear? It is like that. Expectoration is like that of a boiled starch immediately when the patient is rising in the morning. Clear, guys? What did we see? The hemoptysis was there. Along with hemoptysis, there was pain in the occiput, and they get cough especially when the patient goes in the cold air and is walking fast. Expectoration, it is small lumps like that of a boiled starch, and it is especially seen when the patient is rising up in the morning. Sudden attack of cramp in the chest, becomes cold and unable to continue the ascent. So we are thinking about those mountain climbers who have the sudden attack of a cramp in the chest, and they become cold, and they are, because of this cramp in the chest, they are unable to continue the ascent. Intense oppression is felt in the chest, and there is rush of blood to the chest with a slight headache. The oppression in the chest and the rush of blood to the chest is seen with a slight headache. There is emphysema. So we have Coca in emphysema, where the bronchiole, the affected alveoli, is permanently enlarged, loss of elastic tissue. So it is indicated in emphysema. Moving further to the GI symptoms of Coca, they retard hunger and thirst. There is complete loss of appetite, especially for the solid foods. You see, they have loss of appetite for solid food. They keep longing for liquor, stimulants. They crave spirits, tobacco. Ailments from salt food. The flatus is risen with such force. The flatus, okay, it will be risen up with such force. So guys, we see here the flatus in the person is risen up. Let's draw it in the other color. Yeah, the flatus in the stomach is risen up with such force that it seems as if it would rent the esophagus, as if the esophagus would be torn. It comes with that great force. Empty feeling or full feeling in the stomach, which is confirmed dyspepsia in hypochondriacs. So we have this dyspepsia, we have indigestion, empty feeling, or there could be full feeling. Either of the feeling could be present in the stomach. It is also seen in hypochondriac patients who exaggerate their complaints. Abdomen, there is pressure and tension in the hypochondria after meals. You can see after meals there is pressure, there is tension in the hypochondriac. Okay, hypochondriac region after the meals. Flatulence, like when we saw the flatulence, it is incarcerated, which is resulting in violent palpitations. There is violent belly ache. Along with the tympanic distension, abdomen is completely distended. Along with the distension, they have pain, belly ache. Flatus from the bowels will smell like a burnt gunpowder. So guys, imagine if the flatus will smell like that of a burnt gunpowder. Okay, the bullet. So we see it is like that of a burnt. Once it's out, the bullet smell. So we see when a burnt gunpowder, it smells like that. Dysentery, it is indicated in dysentery. Constipation, so the GI symptoms we are saying, stool and anus, under which we have dysentery, constipation. The stool smells like that of a gunpowder, burnt gunpowder. Clear guys? Burnt gunpowder. And there is inactivity of the rectum. The stools will be dry like that of walnuts. The constipation occurs because of the inactivity of rectum, and the stools are so dry like walnuts. The stools are going to be like walnuts, so dry and so hard. The piles or the hemorrhoids, they are very painful on walking or sitting. The sphincters are relaxed. So guys, we see the hemorrhoids very painful when the patient is sitting on the closet, and when he is having constipation. So from this picture, so we see he has hemorrhoids which are worst when the patient was walking and coming to the restroom and he sat on the closet. Secondly, we have constipation and the stool. How is the stool guys? It smells like that of a burnt gunpowder. It is so hard like that of a walnut. Clear guys? We also have dysentery. Okay guys, so with this we come to an end of Coca. I hope all the symptoms are clear, all the points are clear. If you have any doubts, put them down in the comment section. And if you like the video, don't forget to hit the like button and subscribe.